Thank you, and I'm quite pleased to be the last presenter before the cocktails, so let's try to keep this brief. My name is Tuomas Otala, as said, and I'm ex-CIO of Terveystalo Group, and I did a 6-year tenure there, which lasted till last Thursday, so I'm sort of out of the company fresh. And okay, this is a clicker. Most of the presentations in this type of seminar are sort of optimistic presentations of things which might happen in future, and perhaps they might, and I'd say I've seen some statistics that 90% of the startups will fail. But the things which I'm about to present, they are not future, they are not optimistic, they are not sort of vague theories. They have happened, and they are real life in real digital health landscape. I have to start by using a couple of corporate slides because I presume that most of the Swedish participants outside of Finland don't know Terveystalo. Actually, I never used Terveystalo corporate slides inside of Finland because everybody knows the company. Terveystalo is sort of Godzilla of health services in Finland. We started at 2001 or something with something around a couple of sites and 40 doctors. And since then, we've acquired over 150 companies, health service providers. The figure in the slide is 130, but we stopped counting, but I've sort of had my own logbook. Currently, Terveystalo is operating in 170 offices, clinics, over 60 locations, and I think this is more updated slide. 17 clinic hospitals, and 10% of all doctor visits in Finland are managed by Terveystalo Group. We have 2.5 million visits to doctors annually, and we have a patient records system which is a single consolidated system which contains 65% of Finnish nation, and that's the largest by any means in any country per capita patient record system. There are a couple of other figures there, but the key point here is that this is a real-life health services company and a hospital chain. The digital agenda has been extremely important for us since me joining Terveystalo 2009. When I started, the web adoption rate was 3%, which means basically that 3% of all the bookings came via web, which means that 97% were coming from phone booking or something else. Now the figure is over 50, and the last week's figure was at 59.7% bookings coming from web. This is extremely important figure, and the fact that I am using these figures is extremely important. I'm coming back to that one. Also, we have a patient portal which has already passed the 1 million visitors mark. Approximately 26% of all clinic visits end up with the patient visiting patient portal to verify his own data or something else. Is somebody having an alert, perhaps? Okay, let's continue. When I'm speaking about how to make things happen, this is the key part of this presentation. One has to start by using correct words. This might sound a bit odd first, but most of the management in health services company like Terveystalo comes outside of the health services industry. I have a background of IT industry. I've been selling, delivering, developing, etc. stuff in health, in IT industry for different industries. And the point here is that when we combine teams from diverse groups and different backgrounds, everybody starts to use phrases like patient. And patient is extremely bad word when you are making business. Patient is a word which sort of says that this person who is coming to the clinic is sick, it has negative atmosphere, it is not a voluntary visit, it is just coming to get better. Using customer, you are saying the truth. The customer nowadays, especially in the private healthcare industry, is making choices. They are making choices between doctors, they are making choices between clinics, they are making choices between clinic chains. So there's a competition. You should call the customer as customer, not patient. Patient is a bad word. Then, the second thing is that you must measure. You must measure everything in your business. This is business, and it is pure business in that sense that you can measure it. And all the truth is measured and articulated in numbers. So the phrases like this is the best thing or this is the improved or something, those are not so great words when you are speaking of business performance. You should use numbers. And then one of the most important things in this measuring side is the euros. And when we are in Sweden, I assume we are using kronas, but the money side. Somebody must pay for the service. And unless the customer is willing to depart his euros, it is not a good service. And this is a fact, even in the non-profit side and on other businesses like that, like the public side, you have to take the money into account. Somebody has to pay for the development of the services. Then you must use the correct phrase for the doctors, nurses, etc. Those are healthcare professionals. Doctors gives you sort of atmosphere of sort of a movie type of doctor, a person who comes in the room and measures something and then walks out. They are healthcare professionals. And these words are extremely important because they set the tone of discussion. They say what you are aiming. Then, once you have established common vocabulary, you should start doing actions. I'll come to the strategy side in a while, but to keep the things moving, you need to keep things small, extremely small. Any project shouldn't be over the, let's say, 1 month or 2 months or something. And I know that this sounds quite strange because the IT industry and the health industry has the notion of projects being 1 year, 2 years, 10 years or something and then failing. You shouldn't do that. You are in a business, you are trying to reach something. You should make things simple, fast, efficient. And also you should demystify. Health IT, I do agree with the previous presenters, health IT is a sort of medical grade stuff, but then still it is IT. There are regulations, of course, in the health industry, but there are regulations also in the food industry. In the machine industry, there's regulations everywhere. You have to adopt them and you have to obey them. But still, the IT is IT. The bits and bytes are bits and bytes in the food industry and in the health industry. There's nothing sort of magical in this. And all the normal rules in the developing stuff and building stuff and maintaining stuff apply. There's nothing magic here. It's plain work. You should have a good team with a passion to excellence, and it's about the individuals and the skills of those individuals in team. But then again, you should listen the customers and healthcare professionals, because they are paying the stuff and they are doing the stuff. You are just facilitating it. You have to honor those ones who are paying for the show. And then I think for the most of the health projects I've visited, I've done quite a lot of studies, and I've had my own consultancy company for 6 years now as a sort of side hobby. I see the problem in healthcare IT projects that those are trying to reach perfection. Perfection is bad. You should not try to reach perfection. If by some strange occurrence there is a perfection in a project, then be happy about that, but don't try to reach that, because you have to go to the market to test it, and then do it, and then revise, and then reiterate or scrap. It is extremely straightforward, and trying to reach perfection is a bad thing. Perfection is something which is out on the distance. Live day. In Terveystalo we did quite a lot of these small, simple projects, and this slide has some of them, and I know for the fact that it is a busy slide, but it is supposed to be a busy slide because we did huge amount of experiments and all kinds of interesting tests. For instance, the first mobile application for web booking, or for mobile booking, we did that around 5 years ago. It was the first in the industry, and it was extremely interesting. I'll come back to that in the detail. Then we did the second one, the third one, and the fourth one, and then we stopped counting because there was no point. And at that time, we were still the single only player in that market in Finland. And it pays to be the first. There are reasons behind that one. Also, this slide has some failures. We did the first web shop of health services also. It was a small project, a couple of weeks, and we tested it with a couple of products, and they failed. Actually, they were selling, yes, but not at the rate we were wanting them to sell. So it was a failure, and we accepted it within 1 month, and then we didn't scrap the web shop, but it's still there, but let's be honest, nobody finds it unless I say it. It's there. But trust me, it is there. Some examples of doing small things. The web a mobile application for booking was a good example. If you check that application in the App Store, this particular slide is about the iOS version, and it is a rather nice looking application. It makes booking extremely straightforward, fast and fun, because while you are selecting the doctors, you can slap the doctors in the face. It's sort of amusing to me, at least. I do appreciate slapping the doctors to the face. This project took approximately 3 weeks to complete with a team of, if I remember correctly, 2 or 3 persons. So you can try to deduct the cost of that project, and we launched it, and since then we were something around couple of months one of the most downloaded app in App Store in Finland, and a couple of other markets, because we were getting copycats also. And today there are over 120,000 installations of that application. This is quite huge because, first, it is a forerunner application. We've had corporate customers who have said that they have selected Terveystalo due to the fact that they can make the reservation easily. Extremely important for forerunner companies. You have to be in par with those companies. Secondly, and this might sound a bit strange, but approximately 120,000 mobile handsets have the advertisement of Terveystalo in their screen. And one of the goals we are trying to reach is the top-of-mind recognizability, interesting word by the way, because we have to be the first service provider to come to mind when customer is feeling need of services. So we have the advertisement of that for our services in his phone or her phone. A nice project, short, sweet, not so expensive, and extremely amusing. We did 4 of those. Second one is much smaller example, and this is a particular I'm fan of this particular case because when we did that project, it was the technical side of that was something like a couple of days. We had to train the call center agents to do the chat side. All in all, there are approximately 120 call center agents in Terveystalo, and the chat is a service provided team of those. I was scared shit when we launched that in one Wednesday. I was fearing that I will be crucified, I will be nailed to the door because when the customer is making a booking, it is quite intimate moment because you have a problem with your health, and probably it is somewhat embarrassing. And I was fearing that, oh well, there's a person who has a problem with her health, and then there's an agent popping up saying that, oh, could I help you, please? And I thought that, oh well, we'll have a good day today. No worries. Chat services have been operating in different industries for ages now, and as well of those, this was received extremely well. It was a total runaway success. Customers even like it more than the phone side. They want to chat using that. With such a small project, with such a large fears, it was extremely good project. Then, follow your progress. We used, and we are still using, Google Analytics for following website and also mobile side. You should do this, and we did a lot of this. I even had a conference room televisions hooked up so that they show online active real-time Google Analytics page, just to show our team that the customers are using the service and how they are using. This is extremely important because otherwise you can't see the customer in the web space. You have to see the customers to believe it, and you have to see how they are behaving in the system, how they are working, how they are using the systems, etc. And this is a thing which everybody in team should do. I know typically this type of metrics are being asked by media companies to please provide us analytics of our sites, etc. No, it is extremely simple, straightforward, do it yourself, and you will learn quite a bit. Of course, you should follow the metrics on the euros also, but this real-time view is extremely important. Use it, and everybody in team should use it. Then, one of the most important things is to know where you want to go. Because as a business, Terveystalo has a corporate strategy. There is a number of goals there, and there is a number of programs there. There is a number of projects there which dig into the actions. So everything you do in your business should and must be linked to the strategic goals and programs and projects, etc., of your company. This might sound a bit strange again, but this is extremely important because you have to keep connection to the business. Otherwise, you'll end up doing all kinds of interesting pilots which overspend, overachieve, and are not linked to the goals. So you should always keep the strategy in mind and then use only those resources for those goals which are optimal for your business. I've seen, even today, I've seen quite many project and program and application presentations in these seminars, which I really don't believe are linked to anybody's goals. IT shouldn't be fun. IT shouldn't be hobby. You should do only things which are benefiting your company. IT is a side story of stuff. Businesses are nowadays digital. IT is a way of doing things digital. Okay, I think I'm sort of overemphasizing this don't like IT stuff, but I think that as a CIO, you shouldn't be hobbyist. You shouldn't have IT as a hobby. You should really sort of think it as a method of getting businesses done. You shouldn't love bits and bytes and all kinds of three-letter acronyms. You should love customers. You should love happy employees, etc. Never love computers. It is a strange theme. In the end, it's all about individuals in a team making a group effort, trying to reach one thing or another thing, small steps and small goals, and going forward with the sensible ideas. It is day-to-day management of all kinds of strange projects and trying to reach goals. There's nothing mystical, there's nothing magical here. It's work, it is professional work. I'm an IT industry professional. I know a thing or two about projects. They are meant to be done. They are not things to be sort of lifestyle. It is not hobby. Okay, and one final thing. I did relate some of the presentations today that I didn't make any comment on the technologies. Technologies today are such that everything is possible. It is interesting, but everything is possible. So you can do everything. You can do anything with the technologies today. But the key point is to try to find the important things and leave out those which are not interested. And then reach those things which are beneficial to your company. That's the thing which I wanted to present, and here are contact details if somebody wants to reserve a time with the Terveystalo's doctors and so forth. Thank you.
Tuomas, thank you. Thank you for also proof of concept and showing us a success story. Please sit down, and hopefully we'll have some questions by our distinguished panel here. And yeah, before we introduce our next keynote speaker.
Well, I just have a comment. I was very inspired by your talk, and I think you're a model for others to follow. I hope so anyway. I especially like your just do it mentality. Keep it simple and reiterate the projects. In Sweden, we have so many really good pilots, but they too seldom get developed into real services that are tracked and followed up and so on. So you're really something for us to follow, I hope.
Thank you.
Okay. I was asked to come up with a question for you. So my wondering here is, do you believe that digital health would be more of a business-to-business model or a business-to-consumer? It seems like most of the companies here are talking very much aiming at the consumer, but I see that money is where you work with the business-to-business.
I think that is a trick question, to be honest. It is a good question, yes. But the point is that the European lifestyle is going all the time towards the person-centric health centric. You are making your own decisions, you are making your own goals, life is your own, health is your own. Despite the fact that there are these insurance premium, there are governmental payment systems, etc., in the end there is a person who makes the decision to use the service, and it is the customer. And that's the reason I am particularly keen to use the word customer, because the customer is a person who makes choices, and the choices hopefully are using your services.
Any more questions, insights? No?
No, I think it was a great presentation. Thank you so much.
Thank you.
Yeah.
And I'm just, based on the fact that you're such a successful and also knowledgeable entrepreneur and businessman, if we have, I presume, both in the audience but also in the webcast, entrepreneurs within the health sector, what kind of advice would you give, or what challenges would you put to the surface that they should think about with your let's just do it mentality?
I think that you should always do a lot of thinking and testing, and then all kinds of wondering whether this is good or bad or anything else. But the point is that when you are doing stuff, you do to the end. And you do the iteration, you do all kinds of changes, you adapt to the different situations, etc. But you do the case to the end and then exit it.
You execute it.
Yes.
Well, thank you so much for that inspiring speech, and hopefully
Thank you.
now you'll also be joined by Chander. Thank you very
Okay.
much.